Welcome friends once again for our NPTEL MOOC module on health economics. This lecture is clarifying clearly on the difference between economics of health and economics of healthcare. As in progress to the previous lecture, we have actually clarified what is called economics of health as a good, how economics or health is considered to be an economic good. Now we are clarifying the difference between economics of health and economics of healthcare. There are obvious confusion with the readers with these two terms, and based on that, somewhere we will be addressing the quantity issue, somewhere we will be addressing the quality issue, and accordingly, different institutions are designed. The agents which we have emphasized in the previous lecture are actually very important while defining economics of health and healthcare. The important learning goals which we have kept in this particular lecture are understanding the concept, the broader concept of health economics, and differentiating these two. What is the overlap of these health and healthcare? It's not just clearly differentiated. Obviously, there are overlaps. We'll be emphasizing this. As a broader concept, while exploring or understanding through text, health and healthcare from a distinctive lens of economics, one may find text using different terms referring to health or healthcare, and often these two terms are actually used interchangeably. Some of the terms we use like health economics, economics of health, and healthcare economics or economics of healthcare. Few texts also use names such as economics of medical care. There are also books and articles available on pharmacoeconomics and pharmaceutical economics as well. And in our understanding, these are broadly interchangeably used, and should be the thin line between these two should be clarified. Therefore, this lecture is identify point by point differences of these two terms. So we have kept as a beginner's dilemma: is economics of health the same as economics of healthcare? For a beginner, all these terms might be confusing. Questions such as do these terms refer to same issues? Is it right to use them interchangeably as they or the authors use sometimes in different context? Why so many terminologies? The existence of these different terms implies that the concept of health is very complex and significant in different context, especially so far as economic discourses are concerned. Health economics, as highlighted here, is broadly clarified through healthcare and health, economics of healthcare and economics of health. When we count the discussion of healthcare, we usually refer to the hospital industry and their services, economics of medical care, pharmaceutical economics or pharmacoeconomics. Whereas the economics of health largely deals with implications of ill health related to patient's health or determinants of ill health, etc. And health economics also includes health status, their awareness, theories, practical approaches for welfareism, etc. This terminology also suggests that the field of health economics encompasses questions that go beyond just the provision of health services by healthcare professionals. They are also referred to as healthcare. Instead, it includes a broader range of inquiries related to health itself. In health economics, though health economics are interested in healthcare as a sector of the economy, they are equally interested in ultimate aims such as improvement of health, and to do so this includes various dimensions of health economics, including healthcare economics, drug or pharmaceutical economics, analysis of or the impacts on patient's health, socio-economic implications of ill health, determinants of health, etc. Additionally, theories and empirical approaches to understand health status, analyze awareness and adopt different approaches to spread awareness backed by applicable theories are important as part of health economics. So these aspects we have already highlighted in this diagram. You can follow between the lines. So elaborating what health economics inculcates. In other words, health economics studies not only the provisioning of healthcare, but under health economics, economics also aim to analyze how healthcare is impacting patients' health. Moreover, health economics also focuses its interest on other aspects of the social and economic life of individuals that affect health in one and other way. This includes analyzing the effects of education, unemployment, housing, and lifestyle, etc., because these are also the relevant important factors affecting healthcare. Why is it important to understand the difference between health economics and healthcare economics? It is important to understand because each field has its own unique focus and set of tools, and accordingly policies should be actually designed. When we clearly distinguish these two, and as per the requirement or the scenario or the context, the policy might be emphasized. A person working under a broader category of economics may study a wide range of topics such as the impact of education on health and the cost of effectiveness of new vaccines, etc. Whereas healthcare economists are more likely to focus on the topics that are specific to healthcare sector, such as impact of hospital consolidation on healthcare cost or the pricing of prescription drugs. So it's purely specifying the patient centric analysis. Whereas the peripheral aspects are also covered in other domain, which we have just mentioned. A general example differentiating these two is mentioned here. A person might study the impact of new smoking, cessation program, congestion program on the health of smokers and the cost effectiveness of the program. Basically, any smoking related drives or programs are mentioned, how it is actually impacting the health and how to how far, especially when we say how it is impacting health, it is actually specific to the healthcare sector. When we are saying the cost effectiveness of the program, we are actually referring to the health economics of health. Okay. Another person might study the impact of new payment method for hospitalization on healthcare, on hospital cost and quality of healthcare. This is concerning healthcare. Okay. The first is part of health economics, which I have just said, where we are actually emphasizing on the program. Okay. And on the second, we are actually referring to the healthcare, economics of healthcare. And an economics could study both of them, that is health and healthcare. But he or she would actually focus on different aspects of economics, maybe in a micro context or maybe in macro context. So some of the practical examples are also given in the readings. Here we are citing one, a study of the cost effectiveness of making COVID-19 vaccines available to all people regardless of their healthcare system. Availability would come under the economics of health, whether this is actually availability of these vaccines is actually part of the economics of health, whereas the implications of those vaccines on the patient and their effectiveness of this is actually part of economics of healthcare. Impact of different COVID-19 vaccines and the distribution strategies on healthcare capacity and cost would come under healthcare. Therefore, the healthcare is more core so far as health economics is concerned. Core in the sense it is directly addressing the need of the patient, whereas the first economics of health is addressing the system as a whole. So under the economics of health, an economist might calculate the cost of vaccinating everyone in a country, including uninsured or underinsured, estimate the number of lives that would be saved by vaccinating everyone, compare the cost of vaccinations to the benefits in terms of lives saved and healthcare cost avoided. Under the economics of healthcare, an economist might study how different COVID-19 vaccine distribution strategies would actually affect the demand for healthcare services, and they may estimate how different distribution strategies would actually affect healthcare system capacity and their cost. And the impact of distribution strategies on equity and access to care is part of healthcare aspects, economics of healthcare aspects. Uh, to actually summarize these examples, we can, you know, discuss that both persons in the context could study COVID-19 vaccine and healthcare system availability, and they would focus on different aspects of the issue, which you have already said. First, economist is more interested in overall cost effectiveness, which I have just said, of the vaccination, focusing on micro level, analysis, while the second economist is more interested in the impact of vaccination on the healthcare system, which is in a larger context, understanding whether the impact can be replicated in different context, or therefore here we are saying as a macro level analysis. The Here you can distinguish two things, micro level and macro level will also clarify in a different chapter. There might have been some confusion at this moment, but especially we wanted to say that when we are emphasizing a particular program, not addressing purely on the healthcare, that's called economics of health, whereas we are emphasizing on the impact, etc., particularly related to the quality of something, quality of the care, etc., is part of the healthcare system, economics of healthcare. This is just one example how health economics and healthcare economics can be used to study the same issue from different perspectives. Okay, so we can understand. We have already followed different examples, different direction in our previous slides. We learned that although the economics of health and economics of healthcare are subgroups of broader complex topic, that is health economics, still both subtopics can be differentiated on a range of things. So those broader range we have highlighted here, it is discussed. We will be distinguishing these economics of health and economics of healthcare through their definition, through the scope, methodologies, demand and supply, access, financing issues, and policy directions. Understanding the distinctions between health economics and healthcare economics is crucial for the effective decision making in healthcare sector. Therefore, we need to identify each of them very carefully. So far as definition is concerned, health economics is the study of allocation of scarce resources to improve the health of individuals and the populations, whereas healthcare concerning the particular aspects, especially healthcare economics, is a subfield of health economics that focuses specifically on the healthcare sector and from a broader perspective, including population level healthcare utilization patterns. It studies the production, consumption and distribution of healthcare goods and services. Whereas so far as economics of health is concerned, it uses economic theory methods to analyze the cost and benefits and efficiency of healthcare interventions, programs and policies. The economics of healthcare studies the production, consumption, distribution of healthcare goods and services, which I already mentioned. Healthcare economists use economic theory and methods to analyze the structure, functioning of healthcare markets and the impact of healthcare policies and intervention on the healthcare system. So far as the scope wise distinctions are concerned, primarily the focus is on, in case of economics of health, the focus is on microeconomic aspects of health, delving into individual patient choices, healthcare provider behaviors and resource allocation within healthcare facilities. Whereas economics of healthcare concerning broader scope, encompassing healthcare financing, policy analysis and system level assessment, it examines the macroeconomic aspects of healthcare delivery and administration. Coming to the point like demand and supply, we are now sticking to the explanation of demand. Economists term the demand for health as not something that they just want, but something that they need. Like individual patient choices, preferences and then behaviors related healthcare utilization, Whereas economics of healthcare, economics terms, demand for healthcare is derived from the demand of health. It also considers healthcare demand, but from a very broader perspective or from a macro context, including population level healthcare utilization patterns. So far as supply is concerned, the economics of health focuses on resource allocations within healthcare facilities and provider behavior, whereas the economics of healthcare considers healthcare supply in terms of broader healthcare system, including number of healthcare facilities, healthcare professionals, medical technology and their availability, etc. Coming to the methodology wise comparison, while both fields are related to health economics, they have unique areas of focus in terms of their methods and analysis. Like in economics of health, it utilizes methodologies such as cost effective analysis, CA broadly discussed, to assess the value of healthcare interventions. It measures the cost and outcomes to determine most efficient allocation of resources. Utility assessment is also a common tool to gauge patient preferences. Whereas in case of the other one, it often employs policy analysis to evaluate the impact of healthcare policies on various stakeholders. Econometric modeling is frequently used to analyze complex healthcare data and estimate the effects of policy changes, and therefore economics of healthcare is largely used in different papers in the recent times, emphasizing on the number of directions. Understanding the accessibility, it explores healthcare access primarily at the individual level, which you have already said, considering personal barriers to care. Whereas in case of accessibility for economics of healthcare, it analyzes healthcare access from a systemic barriers to access and disparities in healthcare availability. Another distinction is through financing aspects. These touches on financing, the economics of health touches on financing, but primarily focuses on microeconomics aspects like individual finance for healthcare choices and their resource allocations. Whereas in the economics of healthcare, the focus is on the mechanisms by which healthcare services are funded and paid for, and including such as insurance system or government schemes funding, etc. All right. Then coming to policy interpretations or the policy differences to distinguish in economics of health and healthcare. Economics of health addresses policy, but often at a microeconomic level, looking at individual patient decisions and their economic implications, whereas the economics of healthcare addresses healthcare policy extensively, including government regulations, healthcare reforms and their impact on healthcare systems. It's not just the distinctions which are important, there are also overlaps between these two. Like it is important to note that there is an overlap in these two, such as these two, like allocation of resources to improve health is actually concerning both the approach, maybe for health, economics of health, as well as for economics of healthcare. And the important overlap between these two field of explanation for health economics is through social determinants. They are actually part of economics of health. They are also part of economics of healthcare. Okay, and so we have highlighted here called socio-economic determinants or the situations which are actually determining the choice functions or defining health as an economic good. Okay, so I think we have also cited some of the other clarifications, and these socio-economic conditions can have a significant impact on people's health and their healthcare cost. Therefore, they are overlapping in both the explanations. Both health economists and healthcare economists are interested in studying impact of social determinants on health and healthcare cost. Okay. So, in short, I know we need to conclude what is the necessity of distinguishing these two. Actually, there are distinctions for specific policy designs for specific evaluations. However, there are complementary trees between these two fields as well. Therefore, some of the targets through joint evaluation of micro and macro perspectives are required. Health economics and healthcare economics are two distinct but complementary fields of study. Health economists and healthcare economists use their skills and knowledge to improve health and healthcare in different ways. The interaction between health and healthcare, broad understanding of the determinants of health and their cost and benefits of different healthcare interventions. It can provide a more comprehensive understanding of the health sector, including the behavior of healthcare providers, consumer structure, function of healthcare markets, and their impacts on healthcare policies. Especially on this distinction, we can clearly draw certain understanding on interventions in healthcare systems. So, we have discussed largely on the distinction between these two. In our next class, during this lecture, we learned something which we have just mentioned, deep rooted dimensions of these two fields of explanations. Before unveiling those dimensions, one needs to know reasons behind the complexity of health economics. Therefore, finding answers to some of the important questions: what makes health and healthcare different from other economic goods, and what is that makes healthcare special? Okay, these questions were raised in the last lecture as well, and we have explained health is an economic good, and therefore these are going to set your understanding, the fundamental clarity on this particular topic. The last lecture of this week would surely provide a destination to the minds seeking the answers to the question that to from Arrow's perspective, who laid the foundation of health economics. We will be also emphasizing these aspects as well, and I think that will help you to develop your understanding on healthcare, especially social choice functions, how Arrow's perspectives are defined, and we have cited some references. I think those will be also helpful enough for you for your preparations for the exam, as well as understanding health economics as a discourse. With this, I think it's time to close. Thank you.